Well, we are back this afternoon with our medical expert, Dr. Payal Kohli. And this afternoon, we're going to talk all things ear, wax, and snot.
Yes, we are. Let's start with our ears. So what is earwax made up? I don't know that I've ever asked anyone that question. What is earwax made up of?
Great
So
question.
it's made up of a whole bunch of really nasty things.
Okay.
So we have two glands in our ear, sebaceous glands and ceruminous glands. It's called cerumen. That's the medical word for earwax. And they release this sort of substance. And then it mixes with hair cells, with skin cells that are dead, and then with any other debris that gets in. And it actually is made inside your ear, and it makes its way out. So it moves a little bit every single day, like a fraction of a millimeter every single day, and then it just kind of falls out of your ears.
Is it good to have it?
We're supposed to have it, so it actually evolved evolutionarily to protect us. So it does two things. It lubricates the ear canal, right, so that it's nice and lubricated, and then it also traps anything, little insects or any dirt or anything else that might want to get in. When you start having too much of it, or it's not coming out the way that it's supposed to, not expelling from your body, that's when it starts being problematic.
Well, we're not supposed to see it. That's like the biggest ick. I saw someone today with a bunch of earwax, and I was like,
But that's a natural body response,
I know, but
ladies.
no one wants to see it. I get earwax, I don't want to see it. Yeah.
No. We'll talk about that in a minute.
oh, we'll talk about
Do
it.
not stick anything in your ear.
No
In fact,
Q-tips?
Nothing, never. If you have no symptoms of hearing loss or problems with chronic impaction of earwax or anything like that, same for your kids, do not be sticking things in like Q-tips, cotton swabs. Don't use those ear irrigation candles. Don't pour things in your ears. That is not the way you're supposed to clean out the earwax. Your body is supposed to expel it. So for most people, I recommend don't put anything in there. Just let it fall out on its own.
Ew,
Now,
Dr. Kohli.
Yeah, no.
If it's just on the exterior there, you can sort of lift it out.
We just don't go all the way
Do
into
not
the ear
put into
canal.
the ear
So,
canal.
okay, that makes sense.
you can just scoop.
You can scoop it out.
Yep, little cleanse.
You can scoop it out, and then your earwax tells you a lot about your ancestry, in fact. So
Ancestry.
if you're
So does it
African or European, your earwax is likely going to be brown and sticky. And if you're East Asian, your earwax is actually what's called dry earwax. So there's wet earwax, and then this is dry, which is sort of more gray and flaky.
Whoa.
Yeah.
What does it reveal about your health? If you're sick, does your earwax look different?
So COVID-19 has been found in earwax in people who've been infected with the infection. They're looking to see if they can use it to look for type 1 diabetes, type 2 diabetes, look for heart disease markers, because again, it's one of our body secretions. Could we study it? And there's some genetic disorders, that maple syrup urine disease. It's a rare disorder of metabolism where the earwax smells like maple syrup. So as soon as the baby's born, you don't even need to pay for the fancy genetic test.
Just
if
smell.
that earwax smells like maple syrup, they probably have that disorder.
Whoa.
Yeah.
Okay.
Fascinating. I feel like I have so many more questions about ears, but you're also here to talk about snot.
Yes.
So let's do that. What's snot?
So it's mucus made by little tiny cells in our nose, and the point of it is it sort of filters out air that we breathe in. It warms things up for us. It humidifies the air that we breathe in, but it also has antibodies and immune cells, so it actually protects us. So it's an active thing. And of course, most of us clean our noses every day, take out the mucus, but some mucus is supposed to live in there to help protect you.
So what does it tell you about your health? Can you check it every day and make sure that you're feeling, I mean, I obviously notice if I'm sick, my
Yeah, it's always like green and like thicker.
Yep. So we look at a few different things. We look at the consistency, we look at the color, and then we look at the volume. So when you're cleaning your nose in your shower, it's a good idea to sort of look and get a sense of what your normal is in terms of your mucus. Because if it's really thick, it's probably a sign that you're dehydrated. If it's changed in color, it should be clear. If it's changed in color and become white, you may have some congestion, either some allergies. If it starts to become green or yellow, then you get concerned about a viral or bacterial infection, especially if it's prolonged for more than 5 to 10 days. And then if there's any pinkishness in it, you can get blood tinging in your mucus, in your snot. So make sure you keep an eye on it, just so you sort of have a sense of what it's doing.
Yeah, that's always scary to me when there's like a little, when you blow your nose super hard and you get a little blood.
Or
I'm
your
like,
kids,
"Oh."
yep.
Yes, and that's like really scary. Should that be scary?
Well, yes, it is. And it actually should tell you that you need to do something different. So
Okay.
the point is not just to look at it, but look at it and then change your behavior. So if you blow your nose really hard and it's blood tinged, you need to probably use a humidifier or put a little Vaseline in your nares when you sleep at night, because we live in such a dry climate. And so that's an important change. If you think that it's thick, you need to drink more of that water. Make sure you're getting in there. If it's really runny and you have too much of it, then you're concerned that you might have allergies. You may need a nasal steroid to actually sort of decrease the volume of it. And the nice thing is a lot of research coming about how we can actually change the snot, the mucus in our nose, to make ourselves healthier. So there are companies that are working on nasal sprays that you could spray into your nose because, imagine we have lots and lots of bacteria living in our nose. It's called the microbiome, just like we have in our gut, of our nose. And that's what protects our immune system. So if you could put a spray in to change it, that would be quite amazing.
Whoa.
But for now, I want you to focus on hydration, 6 to 8 glasses of water a day. Leafy greens are really good for promoting sort of healthy bacterial colonization in your nose. You want to avoid too much dairy and too much processed foods because that can have the opposite effect. It can actually create excess phlegm and mucus, and it's not good for you.
Wow, great information.
I learned a lot today, Dr. Kohli.
We
Were
will
you
be
grossed
right back.
out, or?
No, I mean, yes, but hey, I learned a lot. Dr. Kohli, as always, thank you.